to the accountability series. It's been a couple of weeks at least since I've videotaped. If you've been following, my last videotape was about what it was like to come home and figure out that what happened to me should never have happened, and to start grappling with the injuries and the stress involved. So today we're going to talk about the exponential potential, but first I want to make something clear. I was watching my other video and I realized that I wasn't very clear about something, and that was the list that I gave of all of the places that I called trying to report what had happened to me, when I was wanting to prevent someone else from being injured, when I was looking for help, when I was also looking for accountability. I gave a huge long list of all the places that I called. So number one, I want to say that list that I gave, which was very long, was not an exhaustive list. It was just what I happened to piece together from all the notes that I'd taken during that time, which sometimes I didn't take notes and I would just make a call on a whim, like, who else can I call? I thought that I wasn't doing something right. I thought that I couldn't find the right person, but that there must be a right person. So I tried many, many avenues that didn't work, and that was just some of them. Um, so there's that, but also I want to express that list took months, like 7 or 8 months for me to complete before giving up on trying to report this to anyone. And it might have come across as in that first week I reported to all of those places. No, each of those places that I called took time and energy, and it was very frustrating to find that there was zero accountability within the Ohio health system and other brick wall systems. And I will talk more about some of these other brick wall systems later. All that to say that in this video, I'm going to talk about the exponential potential of the reverberations of from dismissing even one patient who has been injured or killed by medical negligence. Using a bit of my experience and imagination, let's take a look at the exponential potential here. Let's say in one scenario that my kids were not grown adults at this point. Let's say that they were little kids at home and we live paycheck to paycheck. Who's going to come and help us? Who's going to cover those bills? Who's going to feed us and clothe us and make sure my kids get to school and are taken care of and protected? Who's going to keep the lights on? Yeah. Let's pretend that I didn't survive. Yeah, so you could very quickly see how when one person is injured, it can have a ripple effect on the family and in relationships. So I was really thankful that my kids were grown and gone and didn't have to see me through most of that suffering, and were not affected in their daily lives from what happened to me, not fully. And then there were other relationships that were affected in my life by what happened to me. I really closed up on myself and I was just basically shut down. I was shut down emotionally and physically and mentally. I went through an awful lot that I just wasn't dealing very well. And next, how does it affect future patients? Okay, so this surgeon continued to, and continues to be promoted as a specialist within Ohio Health. And Ohio Health, dear Ohio Health, dear Steve, hello. You are wittingly putting patients in danger. You know that he was abusive towards me. You know that he hurt me. And yet you continue to promote him to future patients. And what happened, I mentioned this a few videos back, but maybe you won't recall, or maybe you didn't see those I don't even know where it was that I mentioned this. There was a gentleman who was injured after me, needlessly injured after me, because nothing was done when I reported this. He found me when I was protesting. He found a way to get a message to me, and we talked about it, and he was injured in an abusive way. Ohio Health, you are complicit in hurting your patients. And then there's the societal level, at the higher level of beyond the immediate family, beyond the next patients, at a society's level. Who do you think is paying the bills, the SNAP benefits, the Medicaid bills? You know, I had over 200 appointments now that were related to what happened to me. Who do you think covered those while I wasn't working? Who do you think covered those bills? And what about other people who are actually in the hospital, like hospitalized for long periods of time? Each day in the hospital costs, I don't know how much these days, probably a couple $1,000s a day. Um, and yeah, you're paying for that. So when just one person is injured and dismissed and not helped, it affects an entire family. It can affect a community. It can affect their friends, whoever is in their social circle. It affects new patients who are believing and trusting that this specialist, for instance, is going to help them. It affects society at the society level, who is picking up a tab on, it might be a lifelong tab. It might be a temporary tab. Like, luckily, I have mostly recovered by now. And it doesn't have to be this way. That's the thing. It doesn't have to be this way. If I had been acknowledged and helped to begin with, um, I would have been so much further along from the get-go. So, dear Steve, and when I say Steve, I'm talking to the CEO and president of Ohio Health. That's Stephen Markovich. And so, dear Steve, dear Ohio Health leadership team, please stop wittingly putting your patients at risk. Please start investing in the ones who are injured by medical negligence. Please stop dismissing them as part of the problem and start seeing us as part of the solution in keeping your patients safe. When we voice our injuries to you, you should immediately take us seriously. You should give us the benefit of the doubt and talk to us instead of trying to shut us out and shut us up. It's your responsibility to help out. It's your responsibility to acknowledge. It's your responsibility to prevent future injuries. Liz Florentino, survivor on a mission.